It says it's live.
Okay.
Hey, we did it. I can't believe how long it took me to figure that out. Okay, so thank you, Simone, for being on my first live stream, my first successful live stream. We tried
Okay.
we tried to do this a month ago, and because of the title of the live stream, as you know, YouTube shut me down from live streaming. They opened it back up 3 days later, but I got busy, and there you go. And you're busy too.
Yeah.
So right now we don't have any viewers, but we're gonna go ahead because this is going to broadcast later as a replay.
Okay.
So everybody out there, I know the last time you heard from me, I was in Nigeria posting. I actually made a nice video for you all that I just haven't uploaded yet. I'm trying to debate whether or not I want to upload music with the video. Anyway, in this video, which I promised a month ago, I am interviewing my sister Simone Anderson, and
Hey.
Simone is my baby sister. I have three sisters and two brothers, and Simone is the youngest of the three of us. And I think a very amazing and accomplished young lady. So I want her to talk about the things that she's doing right now. I consider her one of the ultimate capable women that I know. She's doing some interesting things right now that I think would be an interest to everyone out there. And so I'm just going to interview her and let her talk. So Simone, before we go into your history, some of which I know, you have your own private and secret life.
Mhm.
Just tell everybody who you are.
Okay, I'm Simone Anderson, Kenya's sister. Um, right now, I'm working as a nurse practitioner with the company, and I'm also opening my own business with another friend who's also a nurse practitioner.
Okay. And Simone, tell us about your work as a nurse practitioner. Like a lot of people, we know what nurses are, but can you give us the difference between the beginning nurses, the BN, the RN? Just give us that
Okay,
range.
so nurse practitioner, I'm still a nurse, but I can practice as um, um, an advanced with an advanced skill set, which comes with diagnosing and treating certain conditions um, in whatever area I'm specializing, which is family nurse practitioner at the moment.
Okay.
So I can see anybody from the ages of 0 days old, 1 year, 1 day old to 99.
Okay. Okay. So you say you can diagnose. What is the difference between a nurse practitioner and a doctor?
Pretty, I would just say more so the depthness of the education that they receive. Nurse practitioners are more so we do have that skill set that we've had as a nurse, as a bedside nurse, where we have very good observation and assessment skills. But also, we do go to school and we learn how to, um, let's say, how can I put it? We learn how to um, recognize and recognize certain illnesses and conditions and symptoms and treat those symptoms according to evidence-based practice.
Okay.
Physicians, they go to school maybe 8, 9, 10, 12 years, depending on what field of medicine they're in. They also are able to do the same, but they have more in depth as far as pathology and pathophysiology of certain conditions.
Okay. Can you tell us the difference between basically what are the different levels of being a nurse?
So you have your RN, which you can have an associate's in or a BS in. Now they're requiring nurses to get more so their BS in, and then you have the nurse practitioner, which is the MSN in a specialized field such as family nurse practitioner, acute care, gerontological, just depending on what field you want to go into, psychiatry. And then you can also get a DNP, which is a doctorate in nursing practice. in which you can specialize in whatever field you are in your master's, and then just kind of advance that level of education.
Okay. So there is the registered nurse. So there's only registered nurse and then nurse practitioner. Is there like an LP?
But you have your LPNs also. You have your LPNs, and then you have your RNs, and then you have your FNPs, and then your DNPs.
Okay, so you're an FNP.
On my FNP. Well, FNP also along that continuum, you can have a psychiatric nurse practitioner, you can have a pediatric nurse practitioner, acute care nurse practitioner, gerontological nurse practitioner, just depending on what field you want to go into.
But like so the LP, the licensed practitioner, that's the beginning nurse. That's the first level of being a nurse, or do you
Well,
start
no,
off?
well, no, not really. Licensed practicing nurses more so. They can do certain things as well, but they don't have the level of education as a RN has.
Yeah,
But you don't have to be a licensed practicing nurse before you can become an RN. It's just some people choose to go that route just because it's a lot easier to get into.
yeah.
The schooling is less, and you can kind of obtain a job or a career from that standpoint until you're ready to move on to, a higher level,
Okay.
which
So
requires more schooling and more time.
so how many years of schooling are necessary to be a registered nurse?
Registered nurses depends on the program. I would say more so along the line of at least 4 years. You have your 2 years of basic education, and then you have your 2 years of the actual nursing education, your
Oh,
classes and your clinicals.
okay. And then how long do you have to work as a registered nurse before you can become a nurse practitioner? And what additional education is needed?
Well, right now there is no required time. Some programs do require you to have at least worked at least 2 years as a registered nurse. I've seen people who have become a registered nurse and then 5, 6 months later they're going to school for their nurse practitioner degree. Um, Myself, I wouldn't go straight from being an RN to a nurse practitioner because it's just things you need to know in order to be a successful and confident nurse practitioner.
Yeah.
At the bedside or wherever you choose to be in the clinic or wherever you choose to be um, an RN. The education that's required to become an FNP is more so just going back to school, getting this the basic, um, the book knowledge, the advanced pathology, the advanced pathophysiology, assessment, uh, diagnosing, and then the skill set. Going to the clinicals and shadowing somebody or someone that's actually practicing as a nurse practitioner in whatever field that you're going into.
Do me a favor, because this is good information. I hate to stop the flow. It says that we're live.
Hmm.
And do you have someone there at your home that can my page just and so I can see if there's a viewer? It says 0 viewers. And normally people have jumped in by now. I just want to make sure it is public.
You hold on a second. I can actually get my laptop and look.
Yes, that would be good.
Okay,
And
hold on one second.
I'll try on the phone.
Okay.
This is straight up.
Oh,
I'm gonna go on too.
so
Okay,
it
it says
says,
one viewer.
yeah, and that's me. I think that's me that just logged in from my phone.
Okay, and I just logged in. Hold on a minute, let me see. It says
Okay, it says
one.
one viewer. Yeah, that's me. I think that's me that just logged in from my phone.
Okay, now it
Okay,
says
and I
three
just
viewers.
logged on too. Hold on a minute. It says one viewer.
Okay, all right, I think we're in because I see. I'm gonna. Okay, I'm gonna come out. Hold on a minute. All right, so I'm out. You can log out now.
Okay.
So down to two. I just want to make sure. So once you log out, it'll be down to one. So I think we have one viewer outside of ours. Okay, good. We're back to normal. I just wanted to make sure. I apologize, people who are watching this after the replay, but this is my first live. I just want to make sure I'm doing this correctly. All right. So Simone, now we're down to zero viewers. Okay. Okay. So go ahead where you left off.
Um, and just saying, basically, to become a nurse practitioner, you have to, just go through the proper channels, which is you have the books,
Yeah.
then you have clinicals, and then um, you know, take the test, and then the hardest part is finding a job as a new grad.
So let me stop you
Not
right there for a moment. So
okay.
you have, so I'm going to go through the basics. So you have 4 years of education to become a registered nurse, right?
hmm
You worked 2 years or 3 years as a registered nurse before you went back to school to become
I
a nurse
worked 5 years.
practitioner.
I
Mhm.
worked 5 years.
5 years.
hmm
Now, what's the minimum number of years that you have to work before you go back to school to become a nurse practitioner?
Well, most programs require you to work at least from I've known some programs to want you to have at least 2 years of bedside nursing experience.
At least two.
Yes, some
Before,
programs, some don't require
yeah.
uh, any at all.
So you can go straight from undergraduate with your as an RN and straight into a master's program to study to become an RN, or depending on the program, you can work for 2 years after leaving. You can work for 2 years after leaving your undergraduate program before
hmm
entering a master's program to become an RN.
Yeah.
All right, okay, go ahead from there.
Like I said, I wouldn't suggest that a person would, go straight from a new graduate nursing program and then roll into an NP program. You just don't have the experience that's needed to perform effectively
Yeah.
and competently, as I
Okay.
would say.
Okay. So at this point, 5 years have passed. You decided to go back to school to become a nurse practitioner. What
Mhm.
made you decide to do that?
Bedside nursing is rough. I see a lot of nurses that are, older in their 60s and they're still working as bedside nurses and they have, bad backs and bad knee joints. Stress level is high. And it's just not good to, I think, I'm not saying that to the point where it's not good to work as a bedside nurse. We do need bedside nurses, but it's not good to be an older adult
Mhm.
working in those very, very demanding positions like such as bedside nurses. A lot of bending and twisting, and it's just a lot of labor, a
Right.
lot of manual labor, a lot of running around, a lot of stress, depending on the environment that you're in, and it's stressful.
What would you say is the most stressful part of being a nurse?
To me, the most stressful part of being a nurse is the politics that come with uh, whatever institution that you're working in. You know as I worked in nursing, the more as the years went by, they were more concerned about paperwork and documentation. As opposed to, I mean, from my standpoint, it was just more concerned about paperwork and documentation as opposed to us actually taking care of the patient, which I do understand it was because of certain regulations, that had to be followed as, to prevent certain, lawsuits, I would say more so because,
Yeah.
and just to ensure appropriate care
Mm.
because a lot of time, if people aren't mandated to do to document or do certain things, it won't get done. Even if they are mandated. Some of them still don't do it. So to me, it's just more of the politics involved with nursing that makes it harder.
Okay. Tell me. So once you, let me go back a little bit. So once you become a registered nurse, what would you say the comparison is between you as a nurse practitioner now and what you did as a registered nurse, and how do you interact with the registered nurses?
Um, right now, the main difference is autonomy and also the ability to diagnose and treat. My advanced assessment skills and is also another one. And actually, I interact with the nurses more of as we're a team and we're doing this together, and not as me
Right.
being superior to them. I don't like to make nurses think that I'm superior to them. I always treat them with respect because we are a team. Either
So
way it goes. So,
do you sign off on their work, or is that reserved for the doctor?
no, I don't sign for no work at all. I just mainly put orders in, and I still help them if I can. If I'm there with the patient in the room and the nurses are tied up and the patient wants to maybe go to the restroom, or they want to whatever, I'll do it
Okay.
because that's my background is a nurse.
Okay. So how long have you worked? Let's fast forward now a little bit. How long have you worked as a nurse practitioner?
Since 2016 August I started,
Okay.
and it is now 2018. So yeah, maybe about a almost 16, 17 months.
Okay, 17 months.
Mhm.
How difficult was it? I remember we were talking, for those of you who are watching right now, this is my sister, Simone Anderson, and we're talking about her journey as a nurse practitioner. And I'm giving you all some background information because we're gonna get into the meat of how Simone became a nurse practitioner. And the reason why this is not your average story is because of what Simone came from. All right, so you can bear with us and just kind of listen and get the background. You'll appreciate the story even more. So, Simone, you in 2016 you became a nurse practitioner. You've been
Mhm.
doing this 2 years, but I remember you telling me back in 2016 that when you graduated from graduate school, it wasn't that simple to get a nurse practitioner position. Even
Mhm.
though we see all dozens and hundreds of advertisements for nurses online, and everyone says it's a nursing shortage, it was still difficult to to get that position. Tell me about that a little bit.
Well, it is easy to get an actual nursing job, a bedside nursing job. But as far as getting a nurse practitioner job, it's harder because a lot of companies don't want to hire you as a new NP because they don't feel you have the skills and the experience
Yeah,
to maintain the pace that they already have in place. So if
right.
you're going to these clinics, that no one has time to train you. If you're going into whatever field you're going into as a nurse practitioner, they basically want you to already basically hit the ground running. They don't want to have to spend the money and the time to train you. So it's harder in that way. But some people will. A lot of people use nurse practitioners, to kind of, I would say, a lot of physicians employ nurse practitioners because and I know especially in the primary care fields, because a lot of physicians don't like to do primary care work because
Right.
they say um, the work is it's too much and the pay is too little. So
Mm-hmm.
they the nurse practitioners who are eager to start working, and we basically take whatever we can to get that experience.
Okay.
So it just depends on um, it just depends on basically I say your luck at that time of grad. It basically boils down to luck and who you know.
So how did you get experience? Because you kept running into people saying you don't have the experience. Did you have to
Well,
work for free?
no, the last place I did my clinicals, the last semester of my last clinicals practicum, the guy asked me to come back and work with him because he was getting tired and he wanted to work less days.
Yeah.
So the owner of that company, he also asked me to come back and do a couple of days. So I actually started working there. Um,
It was paid work.
hmm
Okay.
and I worked with him. You know, he kind of showed me. Well, he actually, you know, he guided me through certain things, and you know, and so I learned from that. I learned that way from him.
Okay.
I also had learned a lot from him during clinicals. He was a really good teacher, so I learned a lot from him during clinicals.
And just go back a little bit. What are clinicals for those who don't know what clinicals are, and
Clinicals
what that means towards your education?
or your practicum, it's the required hours, the required hands-on hours in an actual clinical setting in order to obtain that degree. So during
A
my
master's
pediatric
degree.
semester, hmm
Okay.
during pediatric semester, I had to do a pediatric practicum slash clinical where I had to work with pediatrics. The same with OBGYN, the same with the elderly geriatrics. So it just yeah, it depends on whatever field you're going into, you're gonna have to do those required hours hands on.
Okay. So the individual that you began working with when you received your master's degree was the same person you did your clinical with.
Hmm
Okay. And tell me, let's graduate a little bit to what that looks like when you work as a nurse practitioner, because you have some pretty gravy hours. Like, I am totally
Yeah.
jealous at your work
Well,
schedule.
that not all of them, not all nurse practitioners have hours. It's just the company that I'm with. I
Okay.
have those hours. Yeah.
So how
So
does
that
that work?
so the company I'm working with is a company that provides services to rehab slash long term care nursing facilities. And I go into facilities, me as well as other nurse practitioners and PAs and MDs. We go into these assigned facilities and we take care of the patients, the long term patients. We provide
Yeah.
routine maintenance care of their chronic and acute health illnesses. And also, we do post acute rehab care to patients who are just coming out of the hospital for anything ranging from a knee surgery to heart surgery.
Hmm.
Depends. And we follow those patients and we treat them. We act as their primary care providers while they're there in the facility. Once they go back home, they discharge to their regular PCPs, primary care physicians, and then that's it.
Okay. And how many nurse practitioners are in this in the clinic that you're working in now, or it's a facility you're in now, correct?
Well, right now, I'm assigned to a facility, two facilities. So I'm the only nurse practitioner from my group in that facility. But the facility also employs other physicians and nurse practitioners to
Hmm.
take care of certain patients. There may be anywhere from about 200 patients in each facility,
Hmm.
and there will be about 4 or 5 providers from different groups taking care of those patients.
Okay. I'm sorry, I apologize. I was falling out of my chair. So I want to talk a little bit about the ease, or is it easy to, once you get that initial experience, do you feel as if it's easy to procure a position as a nurse practitioner?
Not really, because the market is so saturated with
Oh, it's
you
saturated
know
now.
with nurse practitioners trying to obtain positions, and so when they get one, you know, they pretty much stay there until they can find something else.
Hmm.
You know, depending on if they like where they are, if they just want a different type of environment to work in, they just want a different experience.
Hmm.
Depends. Or maybe more money. There's different reasons why people leave jobs and go looking for others.
So it's interesting you would say that the market is saturated, because I still read online and I still hear, just in popular media, that there's a shortage of nurses. So is it safe to say that Are there any people from your graduating class of graduate nurses that are not employed as nurse practitioners?
Well, there is a nursing shortage as far as bedside and in that aspect.
Okay.
You know, they need lots of bedside nurses right now. You know, some places have high turnovers, and it's, you know, basically due to the stressful work environments, demanding work environments. But as MPs, there's a need for nurse practitioners.
Hmm.
Um, like I say, it's just that more nurse practitioners are graduating from graduate programs and
Right.
are entering the workforce. But um, the fact that physicians or companies want NPs that are already experienced, they have little training to do, coupled with the fact that a lot of nurse practitioners are looking for positions. You know, so it's like you're going against the grain in two, three different ways, trying to secure employment.
Okay. So thank you for that information. I was just looking at my notes to make sure I stayed on topic. What I want to do is talk about the fact that you're now trying to open up your own nursing practitioner facility. No, well, I would say primary care clinic, correct? As a nurse
Hmm.
practitioner.
Hmm.
But before we get to that, I wanted you to talk a little bit about your past and
Okay.
how amazing it is. I think it's amazing that after what all the things you've gone through, and we have some of the same history because we're sisters. After all the things you've gone through, that you have made it to this point.
Hmm.
So let's talk about childhood. Let's just talk about when you move. We can talk about when you moved to Atlanta.
Hmm. So, okay, when I moved to Atlanta, coming from Greenville, Mississippi, you know, it was a big change as far as everything from the way people live, the way they act, the way they dress, the
Yeah,
schooling, everything was different. So it was like I was behind in so many ways. Coming from Mississippi, where I was like top of my class, to Atlanta, where I could barely, uh, you know, to Atlanta school system, where I was, you know, struggling. Oh,
yeah.
Kenya, what the fuck?
Uh-oh. Did we lose you? I think we lost her. Well, I see you. I still see you up there though. Okay, everyone. For those, I think there are three. We have three viewers watching. Looks like Simone lost her video, but I still see her image up, so she's still connected. So for those of you who have just come in, this is my sister Simone Anderson, and we're talking about her experience as a nurse practitioner. We get a little background on what a nurse practitioner is and the educational requirements. So now we're going to talk about a little bit of Simone's past, and then we're going to jump forward to how she went from that to now um, opening her own clinic, primary care clinic. And we're going to talk about that. Hold on one moment. That's her. Hello? That's okay. I still see your image up. I mean, not you, but your little avatar. Uh-huh. It's just I think you may have accidentally cut the camera off. If you click the camera icon, it will bring your face back up. Okay. Yeah. Okay. Okay. So that's okay. That's okay. And you know what? I know it's getting late too. So what we'll do is we'll just let you do. If you want, we can just do. I can just close it down. This will be part one. We can do part two tomorrow or Tuesday, and we can talk about your background, and then I think so. About what now? That's okay. That's okay. Well, we can end it right there. And then I'll do a little summary. And then tomorrow, if or Tuesday, we'll go into part two and talk about your background. Okay, what happened in the past. And then part three will be the actual nuts and bolts of opening up the clinic. I have like two viewers anyway. Yeah, yeah. So we'll talk. I'll let everybody know. All right, I'll call you when I get done. I'm done in about 3 more minutes. Okay, bye. Okay, everybody. My two viewers, we're going to end the broadcast here. Simone's having some technical difficulties. She was talking on her phone, and her phone fell off of her lap, and then it went dead. And it's taking a while for her to charge her phone back up. But she has to be at work tomorrow morning anyway, so we're going to end it here and do part two tomorrow or Tuesday, and it's going to get really good. I'll give you a little preview, and she told me it was okay to discuss this with you. My sister um, had a very rebellious childhood with my parents, and it really is a miracle that number one, she's alive, and then number two, that she was able to focus after what she went through and kind of get through school, raise her son, that she has a beautiful son who's about to who's actually a senior right now, going into high school to become a senior, and getting ready to open her own clinic. It's a great story that I want you all to hear. And as she has gone through the steps to open up her own primary care clinic, I've been watching and observing and asking her questions, and I've found out some really interesting things about the process that she's going through. I thought that would be a really good thing to put on my channel because as you all have followed my journey, I try to talk about things that help people look at life differently and look at how regular, everyday people with no inherited wealth, nothing, just your will and just a little bit of faith or a lot of faith and and encouragement can try to excel in things that they're not familiar with. So even though Simone is a nurse practitioner, she's not familiar with this part of her journey. And she's had lots of pitfalls in opening up this clinic. And she's just like me. She's just like you. So please stay tuned for the next part. It's going to be really good. And part of her story is my story because we're sisters. And and stay tuned for part three, which is going to help you see what she's doing now to open her own clinic. And again, with no no help financially. This is just her own resources that she's managed to build up from lots of work. Okay, so that's it. That's part one. I hope you have enjoyed the little bit that you were able to see. Stay tuned for more. And I'm also going to post a video up as a side note on my last days in Abuja, Nigeria, which were really good. I have some good video to show you and some closing thoughts. All right, everybody, be well.